guys, it's Dr. Jono from Gluck Orthodontics, and I want to answer a question that we get a lot, which is, let's say you're in the middle of your orthodontic treatment and you move. What happens? So the short answer is one of two things. Either you transfer your care from your orthodontist that started your treatment to someone new in the town that you moved to, or you maintain your care with the orthodontist who started their treatment, okay? So you either stay with the same person or you find someone new. Now, let's talk through a couple different scenarios. Other variables that you need to take into account are braces or Invisalign. Are you in the beginning of the treatment, the middle, or the end? And then also, where are you moving? So for example, in our practice, we're in Nashville, Tennessee. We have some patients that have moved to Atlanta. It's about a 4-hour drive, who maintain their care with us because they can come every, let's say they're in Invisalign, they can come every 10 or 12 weeks. They either drive up here, they do a short flight or something, and we can continue their care over the course of their treatment. Or, we have some children that move to California, or they move to New York or Seattle or something like that, where it's just not feasible for them to come back and forth between Nashville and their new home. And so then what we'll do is we will, through our network, arrange for them to transfer their care to another orthodontist in their new town. So let's say you are moving and you need to find someone else. Couple things are going to happen. First off is whoever your orthodontist is that you started treatment with, they're going to be your best resource for finding you a new person. You're always better off having a kind of personal recommendation where they say, hey, I know someone I went to school with who practices in Seattle. You should definitely go see them. Let me make a connection. So first off is find someone new in the town that you're going to, and either your orthodontist can help you or maybe a friend of a friend can help you, just so you can make a specific introduction. Once you've identified who that person is, there's a little bit of work that's done on our end. So what we would do is we would fill out what's called an AAO, American Association of Orthodontists transfer form, that then gets sent to the new doctor. Some simple things like, what was the main reason that we started treatment? If we're in braces, what's the brand of the braces? What type of braces they are? Is the patient wearing any rubber bands? Do they have any specific appliances? Where are they in their treatment? Are they're near the beginning, near the middle, near the end? What as the kind of initial doctor, what was our treatment goal, treatment philosophy? Where were we headed, based on where we are now to where we need to end? What do we think needs to happen? And then also, what were our plans for the retainers once we're all done? So all of that gets contained in that AAO transfer form. And then what's also included is a summary of the financial position. So what was the original fee? How much has been paid thus far? What's still owed by the patient? And kind of what arrangements were made so that there's the new doctor knows what to do in terms of payment. So that takes it to another question is, let's say you transfer your care to someone else, usually what's going to happen with payment? Again, it kind of depends, but in our office, most of the time what we will do, and I think this is pretty consistent among other orthodontists, is we will take the number of months remaining in treatment, charge a monthly fee for that. Usually in our office, it's $250, and then add on an additional fee for the removal procedure, as well as the retainers and the maintenance or care of the retainers going forward. So again, if the patient is in the middle of their treatment, let's say it's a year treatment and they have 6 more months, they would pay for 6 months of treatment plus an additional fee for the removal and the retainers. Again, things may be a little different based on where you go, but what I would encourage you is, if you have any questions about the financial piece, talk to either the orthodontist, the office manager, or the financial coordinator at your existing practice, and make sure that you have all your questions answered and you have all the information that you need, so when you go to the new practice, that there's really no questions and they have all the information they need. What you may also need to do is just connect with your old orthodontist and your new orthodontist. Make sure that those two sides are kind of talking, the transfer forms have been passed and all of that stuff, so that when you show up at the new place, that they know who you are and they have all the information and stuff like that. So There might be a little bit of back and forth, make sure that some records are transferred. Usually it's a pretty seamless transition, especially, as I said before, if you are going to a new doctor who has a personal or a good relationship with your existing doctor. So that way, you are a face and a name and a recommendation and a referral, so they know who you are when you show up. So again, just to recap, if you do move in the middle of treatment, your options are either stick with your existing doctor and you can kind of work something out to come back and forth to be seen for your appointments, or you may need to be transferred to a new doctor, in which case the AAO transfer form will be filled out on your behalf, including the treatment plan, what needs to happen to finish, and the financial arrangements. All of that gets sent to your new doctor. And then, like I said, always best if you can have a personal connection from your existing doctor or a family member or a recommendation or something to the new doctor, so that way you can kind of cut through some of the red tape and make sure that you are known when you go to the new person. So, questions, leave us a comment. We hope this was helpful. If it was, please subscribe to our channel. We try to put out as much interesting and helpful information as possible. If there's anything that you want to see, leave us a comment. We love you. We hope you have a great day. Smile a lot. Peace.